Uveitis means inflammation of certain portions of the eye. In the real world, when we mention uveitis, we're talking about basically inflammation in any part of the eye. The inflammation can affect the front of the eye, the middle portion of the eye, the back of the eye, or sometimes the whole eye. And if that inflammation is not controlled, it can cause severe vision loss. When a patient is referred to us for uveitis, what we do is first see what type of uveitis they have. Then we send a workup to determine if there is a cause for the uveitis. About half the time, there is no reason why the patients have uveitis. The different reasons of why patients develop uveitis could be infections, autoimmune conditions, genetic conditions, or even cancer. But again, half the time we're not able to determine the specific reason of why the patient develops uveitis. But in reality, our main goal is to control the inflammation. So if we're able to determine the reason, we find the reason, we deal with the reason. But at the end, the main goal is to preserve vision. So once we finish the workup, we are able to classify what type of uveitis the patient has. Then we set up a treatment plan. And in terms of treatments, sometimes we do just topical medications, eye drops. Sometimes we do injections inside or around the eye, implants inside the eye, sometimes systemic medications. The same type of medications patients use for example, arthritis or lupus. We also use it to treat inflammation in the eye. Sometimes it's oral medications, sometimes are injections that the patients give themselves, sometimes are infusions. It all depends on what type and how severe the uveitis is. Uveitis is the cause of about 10% of blindness in the United States. And the problem is that in our country, there are not enough uveitis specialists. So our goal when a patient is referred to us with uveitis is to try to diagnose them, classify them as soon as possible, and start treatment rapidly to prevent any vision loss.